So how many of you have seen somebody with just sialorrhea? Yeah, you do see a handful, okay. Normally, I'm going to talk about secretion management, okay. We see people with symptom issues in the mouth, okay. And it's usually when you dig into it, not purely sialorrhea. And the number of patients I see who get referred for sialorrhea to our service, and we see them, they're on a high dose of an anticholinergic or a drying agent, mouth is dry as buggery, and the problem is thick secretions. Okay, so it's really not just about sialorrhea. So it's a balance. That's what this is. It's a guy, I don't know if you can see it very well, it's a guy balancing on a, he's really silly, okay? So it's on top of a high-rise building, okay? So it's all about a balance, and it's a balance between too much moisture, you know, sialorrhea pooling out, and thick, dry secretions at the back of the mouth, which can be equally distressing and problematic. Okay, so this is an easier concept than a practical reality. Okay, so the next thing is we want it to become this sort of balance, rather than the guy balancing on the top of a high-rise building. Now, I have a quick question for you guys. Oop. Who thinks calmful? This says the year of calmful balance. Who thinks calmful is a real word? I looked it up. It is, but it's an old word that's fallen out of usage over the past 100 years or so. So it is a real word. I thought it was just made up by some sort of card thing or whatever. Okay, so how do we get from the first balance, precarious, to a nice calm balance? Pardon? Oh, that's all right. Okay. Okay. So this is there's a lot of overlap with the talk that was just given earlier. It's all about empowerment. Okay, and empowerment is not just a politically and ethically appropriate thing. In this situation, you've got absolutely no choice because it varies so much on a day-to-day basis with diet, hydration, humidity, the weather. So the patient and the carer have to take ownership to micromanage these issues. They've got no choice. You know, if you try and do it like once a week, once every 2 weeks, it's something that needs to be done a number of times a day, every day. So how do we get them empowered? What are the barriers to empowerment? I know there's a lot of talks of barriers in the last thing as well. Does anybody want to shout out what one of the barriers might be? Yeah, well, that's the first one I put. So, knowledge, education, understanding. So whatever agent you're going to use or whatever intervention, you need to really make sure the patient and the carer understand what you're doing so they can take control of it and feel empowered to adjust things. Make sure they know what's safe, what's not safe, if it's a medication issue, and things like that. So this is the really simple, obvious one, but I've found over the years there's more barriers to it than that. Another one is anxiety. Okay, if they feel this is inappropriate or they're fearful or they're anxious of it, you know, you've got to really make them, that's where empowerment comes from. They've got to feel comfortable that this is something that's appropriate for them, particularly when there's been years and years of people, you know, trying to control them from a sort of a healthcare perspective point of view. So addressing anxiety is a really big issue. I've had a number of people where secretion management was a major problem until I started them on an antidepressant. And then the secretion management, you know, that barrier was gone. It wasn't such a big issue. So, you know, obviously they've got many, many reasons to be anxious, but you can't just sort of say, oh, well, that's a symptom. It's a symptom, but it's also a barrier to them taking ownership of their own health care. Okay. And another barrier, which is sort of more insidious, which is something that really is sort of, I've only become aware of over the past couple of years. Okay. Now, this is a tape measure. Okay. Now, it's important to use measures for feedback, and this is something that we use in rehab for a number of areas, not just in you know, secretion management in motor neuron disease. And the reason for that is, as Voltaire put it, you know, who was a philosopher from the 18th century, perfection is the enemy of good. or Pareto. You've heard of Pareto charts? He was an economist, mathematician from hundreds of years ago in Italy. He brought the 80-20 rule, so 80% of the effort for 20% of the gain, 20% of the effort for 80% of the gain. And the concept of chasing perfection, this happens in chronic pain management all the time, where people want to be completely pain-free, and it can really destroy things. So this is why it's important to have some sort of objective or semi-objective or practical documentation of what their symptoms were on one sort of intervention versus another, so they can think back, because they'll be very subjective. And if they're chasing complete and absolute resolution of their symptoms, which is very psychologically normal, they can really not accept what is a good solution, because they're chasing a perfect solution. And it can really destroy therapeutic alliance, and it can really get in the way of actually moving forward and addressing other issues that might be just as important. So that's why the tape measure's there. Okay, and another concept. Beware. What do we need to be aware of? It's not a dog. Okay? Okay, the other thing that we need to be aware of is the confounder, or the comorbidity. And I talked about this again, people assuming sialorrhea is the problem when it's thick secretions at the back. So, we've got a number of physios in the audience. What do you do when you examine a joint? I know some of the physios here. Range of motion, yeah. What else do you look at besides that joint? Yeah, the joint above and below. And in secretion management, the joint above and below is the nose and the stomach. So the number of patients whose sialorrhea has been fixed by antacid medications or fixing postnasal drip that I've had over the years is quite a substantial number. So, you really need to take a good history from the patient, listen to the patient, see what it is that's bothering them, and not have a preconceived notion or formulaic approach to this, because they're very individual. Each patient has a different regime, and they really have to take ownership of it. Okay.